There will be times when a patient will return to the OR multiple times. In the case of trauma, they may come back many times in the same visit, or they may, in the case of ECTs, come back in different visits, but the information is largely unchanged in their history. And so we can use existing notes to make things efficient. And so when that occurs, say if a patient comes back for an ECT, we're going to search for their name. Pull our patient up. It's important when you pull the patient up that for different encounters you select the correct FIN number. Every time the patient has an admission to the hospital, they will be assigned a new FIN number, even though their medical record number stays the same. So make sure you select the correct FIN number for the encounter that you're dealing with the day of. And then we're going to go again to add documentation. Oftentimes we'll have favorites or encounter pathway dithered. We're going to make sure that we want existing notes coming up. We're going to say copy to a new note, and we're going to find the note we want. In this case, it's an anesthesia pre-op note from in the past. We're going to select that. And what that does is that brings up an old note. What we'll do it's on the provider to make sure the information is up to date and accurate. And so you may want to update the NPO status if it's an old NPO status at that point. Just like we would with a current note. We're going to scroll down, verify that all the information is correct in the history. Once we're sure of that, we really need to update physical exam, even if we've entered it before. And so make sure all these things are correct. You might want to input new vital signs at this point if those are applicable. Make sure that your physical exam has not changed. Review of management. If you want to input new labs, here's the place, or new EKGs. For example, lab results, we'll put in the most recent labs. Select those, include those selected labs, and continue to scroll down. Verify their ASA classification, and verify that their beta blocker use is the same as it was before. And then the plan needs to be changed every time. So in this case, we're going to change it to a general instead of a primary epidural. And we need to attest again and sign our name. If it's different, we'll change that name. And then at this point, when you're happy with the new note, you can sign and submit. This note, this process does the same thing for a patient who's coming the same visit, and you're a different provider taking care of that patient. The FIN numbers would just be the same in that case.